Welcome to the Pandemic Podcast with me, Dan Astin-Gregory. Wait a minute, didn't you stop the Pandemic Podcast over a year ago? Yes, we did. But it seems that the foul stench of medical authoritarian policy is still very much lingering, with a particularly strong aroma now coming from Northern Ireland, with a public health bill that really is reminiscent of the things that we experienced during COVID. And it seems that the things that we will tolerate will be legislated. And this is a really important bill that we need to discuss. There's a major protest happening this Saturday, and the public consultation is closing on Monday. So we wanted to come to you live for the first time, really in over 12 months, to inform you about what's happening and to give you a full understanding of how this bill could actually impact upon your rights and freedoms, and why it's important to pay attention, even if it's not happening on your own doorstep, because this could really create a ripple effect. So this public health bill has been in the spotlight this week. As I mentioned, the public health consultation is currently underway, and this bill replaced the 1967 Public Health Act, and the deadline for this consultation is now extended till Monday. But there's growing controversy around it. Now, opponents like myself will say that it undermines human rights, it limits medical freedom, paves the way for coercive medical health interventions. And we're here today to talk to Liz Evans, who many of you are familiar, Dr. Liz Evans, who many of you will be familiar with her work, the UK Medical Freedom Alliance. She's been a regular on the show over the last 5 years. And indeed, Geoffrey Peel as well, who's a political commentator based in Northern Ireland, who's going to share his views as an observer on what's happening here. Liz, Jeff, it's great to have you both with us. And I'm so pleased that 5 years on, we're still able to talk to each other and come together at times like this to tackle what's most important. So where should we start? Jeff, I'd love to hear in a nutshell from your perspective, you know, how you see this proposed bill and the implications that it could have, particularly as you're based in Northern Ireland.
Well, yeah, I only came across it really as a result of people like Liz, you know, who has been a great friend of Northern Ireland and has helped us campaign over the years, including the darkest days of the Tyranny, in terms of organising a number of events here. And obviously, this bill kind of came out of nowhere. Apparently, MLAs, that's the acronym for our members of our Legislative Assembly. MLAs were aware of this consultation back in July, but kind of sat on it, largely because, you know, in any regional government organization, the people who are involved tend not to be the brightest, and they tend to, you know, be puppets of the Department of Health or whatever department is in play. And in this particular instance, the consultation document was issued. And essentially, the expectation, I think, on the part of the Department of Health was that it'd be rubber stamped. And that process of rubber stamping is going on. So the consultation goes out, and it goes out to all of the NGOs and Quangos and local government organizations. And they say, oh, yeah, this has to be done. And it's rubber stamped because the minister is undertaking the consultation. But what the consultation document actually says is the most draconian thing I have ever seen. You know, this is beyond belief. This is literally police state Nazism. So what they're proposing doing is knocking down people's doors in the circumstances of a public emergency or a public health crisis. And of course, the type of health crisis that we have just gone through, namely the COVID-19 crisis. So they're proposing in such circumstances, if people are suspected to be potentially contagious, they literally would have the rights under this bill to drag people out of their homes, perform medical examinations on them and testing, and potentially mandatorily vaccinate them in those circumstances. Now, no one in their right mind, no one who believes in any element of decency and democracy and even public health standards could believe that this type of bill would be proposed. Now, they say it's just a consultation, but it's a consultation like the type of consultation might have happened in Nazi Germany, asking people to consult on whether there should be a Holocaust. It is that level of dystopian. So, of course, I and Liz and others have been appalled at this. We've been trying desperately to bring it to public attention. We've been doing things like putting a petition up on 38 Degrees, the so-called open petitioning site. and had our petition taken down because they said that we were spreading misinformation. So it is absolutely appalling. And of course, now the BBC, at last, the BBC has come out with an article saying that this is actually something to be concerned about. And tomorrow there's going to be a major protest at Belfast City Hall about this as well. But it does appear to be mission creep. It does appear that this is going to be started in the regions, because that's the place where they can sort of slip it through. And that was the plan in Northern Ireland. They're going to slip this through. But it's almost cut and paste from the World Health Organization pandemic treaty and the amended international health regulations. So it is clearly a policy that is going to be implemented, not just in the UK, but in probably most of the Western world, and any place really that's considering signing up to these draconian World Health Organization pandemic strictures. So it's absolutely astonishing.
Thank you, Jeff. And Liz, I would be curious to hear from your perspective. You've been looking at issues like this now for 5 years as well, and campaigning on similar policy and positions. What do you see as the kind of primary concerns with this bill or proposed bill?
So, I mean, I think what is astonishing is that having, been through COVID, and we're now seeing the massive collateral damage that has been caused by this state overreach of power, that all of the micromanagement they tried during COVID has actually had no positive outcomes on any morbidity or mortality from COVID. I think that's, the evidence is clear on that, but it has caused massive damage to children's mental health, to the health service, to education, to the economy. So how can it be at this point, when all of this stuff is coming out into the mainstream, that the authorities would seek to, and they actually write this in the consultation, they're seeking to upgrade and strengthen the existing Public Health Act. And I'm like, but what were they lacking during COVID? What did they not have? Because what they did to us, was on the basis of the act they had. So there is no sense to this. And they also, you're right, Jeff, they say in the consultation to bring it into alignment with the WHO's international health regulations. So this is why we opposed the WHO power grab, the pandemic treaty, and the IHR, because although the WHO say, well, we can't make this mandatory, the states will, the nations will keep their sovereignty. But the point is, the nations need very little excuse to take more power. And so this gives them, just having some regulations, whether they're mandatory or not, it seems that then that gives carte blanche to a government to say, right, well, we need to come into alignment with this. So our existing policies aren't strong enough. They're seeking to make it an all hazards approach. So not just about a pandemic or infection to do with radiation or poisoning or whatever, which so reading through this document, so I heard about it probably in August. And isn't it interesting that they start the consultation at the very beginning of the summer holidays? So everyone's away. And it was meant to finish on the 27th of September. But all power to those people who found it, raised awareness, and there was such an outcry and so many emails flooding in that they did extend the deadline by nearly 3 weeks. So I think that's a really good sign. So I'd heard about it and I thought, well, I need to put in a submission. So I sat down about 2 or 3 weeks ago to a 79-page document. Okay, this is a public consultation, 50 questions with multiple levels to every question. It took me, I think, 3 hours on the Saturday and 2 or 3 hours on the Sunday, so 6 hours or so. And I've done submissions before. So this was not accessible to anyone but the most determined person to actually put in a submission. And as I read through it, I could not believe it. And I just want to quote from an amazing human rights lawyer in Northern Ireland called Michael Brentnell, who did a great video interview about this. And he said, the proposed bill is spine chilling and the most frightening proposed piece of legislation I have ever read, and has the potential to take us to a dystopian future whereby we are under the jackboot of the state. So this is a human rights lawyer. So, and going through that for those 6 hours absolutely confirmed that to me. It is horrendous.
Yeah, well, that was going to be my question. I'm glad you got that. I had that in my notes, this particular quote, because it's so important when you hear someone of that nature, a human rights lawyer that describes this bill in such a fashion. And the interesting is it's not hypothetical. We've experienced this firsthand in terms of what the execution of these types of bills look like. And, I made note of some of the key things that I was concerned about, forced medical examinations, forced to go to hospital, forced to be detained in hospital, forced into quarantine for up to 28 days without reason, children kept from school for up to 28 days, forced to receive medical treatment, including potential forced vaccination, which is actually what the BBC wrote about today. It says that health measures, to use the word, ordered, forced to wear protective clothing such as masks, forced to attend training sessions, forced to restrict personal contact, to abstain from work. I mean, this is just like the COVID tyranny all over again. Businesses forced to be closed. And this was always, for my motive for challenging the WHO with the pandemic treaty and the international health regulations. And it's so important that you said what you did, Liz. The motive for me was that these set of documents at the international level risk normalizing and legitimizing what happened within COVID. And you're absolutely right to point out that many of these things not only failed, were ineffective, but were harmful. And the harms of which are still unfolding today, 5 years on since the first lockdown almost. So this feels like the height of COVID mania in kind of so-called pandemic peacetime.
It's even more fundamental than that, in that obviously there are inalienable human rights that are potentially going to be overrun. But even in terms of statute law, and of course that statute law has primacy. Northern Ireland is part of the United Kingdom, and therefore some of the UK-wide statutes come into play here, particularly the 1998 Human Rights Act. And the 1998 Human Rights Act, in effect, brought into UK law the convention, the European Convention on Human Rights, which was signed back over 70 years ago. The UK instigated the Council of Europe, which created the convention. And Article 3 of the convention and the Act make clear that people are not permitted to be tortured. This came directly from the Holocaust. Mm-hmm. People cannot be incarcerated, have medical examinations performed on them, or medical surgery or medical interventions, because this was regarded as one of the gravest consequences of the Second World War. So the convention emerged out of that. And here we have a tin pot administration putting out to public consultation a potential bill that would ride roughshod over the most fundamental human rights that exist in our UK statute law. This is absolutely astonishing. And of course, the minister doesn't pay any regard to this. There is reference to the fact, we in the consultation would like to know what the consequences might be in terms of human rights. But it's like a sort of side note. They're proposing doing things to people that are unconscionable in any democratic society.
Yeah, and the issue of human rights was the very last question at the end of my 6 hours of wading through this. So I went to the Universal Declaration of Human Rights and I went through them. There's, I don't know, about 20 odd rights. And the vast majority, I listed them, would have been infringed by the various draconian measures within this bill if it went through. And I think if this does go through, it is game over for medical ethics. It's game over for individual autonomy. It was on such a flimsy basis. There was no onus anywhere in the document of any proof of any of this. It just had to be a suspicion that you were infected or maybe infected or maybe, contaminated. So where's the right to reply? And apparently if they do break down your door, they do have to get a warrant to go into a private house. They don't have to get a warrant to go into a business. They're delegating that responsibility to a subclass of officers, so not even police. So you've basically got these vigilantes. What safeguards are going to be in effect to make sure that these people are properly trained, that are fully accountable? They're given rights such as, or they're given the ability to demand that someone has to answer questions. So I was like, well, hang on, what happened to the right to remain silent if the police come to arrest you, which is a sort of an official, very sort of carefully regulated situation? You've got some random vigilante health officers coming in and saying, you need to tell us this. What if you don't answer? Can they then get violent? You know, there's just, you can just see where this could go to, you know, it could cause huge public harm. People will be living in fear of having their premises broken into. They can confiscate anything they think might be contaminated, such as equipment, animals. So your pet might be taken away, and people can be taken away and quarantined in isolation for up to 28 days. But there's no right of reply. There's no ability to say, I don't agree with this. I don't think I'm contaminated or infected, so I want to go in front of a judge. You know, you show me your evidence. Because if you start resisting, they've put in the ability to fine you, you know, several £100s, and in some cases 5,000 or up to 10,000. I mean, it's just, you know, like that magic 10,000 that was the big fine in COVID that just seemed to come out of nowhere for doing something. So it's all of that we saw in COVID and more.
Yeah. So Jeff, you know, people, the devil's advocate would say, well, Jeff, it's just a consultation, you know, but my concern about that would be that we've seen that throughout the last 5 years. Again, it's almost a declaration of what you're going to do. What would your response to that be, Jeff? That this is
and this is the defense that's being used by the politicians. They're saying, oh, it's a consultation, and this is going to drag along. I've lost the two of you, so
you're still there. Don't worry.
This is a consultation that will drag along, in that after the bill is drafted, because given the fact that we're at the consultation stage, presumably the people who are going to draft the actual draft bill will take into account the consultation responses, so we're told. And then they'd come out with a draft bill, and then that has to go to the floor of the Assembly for a vote. We're told that it could take 18 months, they say, you know, for the bill to come in front of the Assembly, and then it's going to be heavily amended, and there's going to be a vote at every amendment. And I interviewed Paul Frew, the DUP MLA, a few days ago on the New Era. You can watch that. And in fact, even though Paul and the DUP have been opposing this consultation and the proposed bill, the defence is it's going to take forever for this to be implemented. That may be the case, but when you have politicians who you know cannot be trusted, for example, Sinn Féin politicians saying, "Oh, no, this is going to take forever. It won't be." But that is not the point. How can you consult on something that is so draconian, essentially permitting the imposition of a police state? You cannot use procedural nuance to say that the consultation is nothing to be worried about. The fact that the consultation exists is the problem. The fact that the health minister seems to think that this is okay is the problem. The fact the Assembly feels that it can vote on such legislation is the problem. So we need to scrap the consultation. We need to scrap the bill, and we need to stop this. There is no requirement whatsoever for any additional public health legislation above and beyond the Northern Ireland 1967 Act. So I cannot understand why they don't come out and stop it. And if they don't, one, I would like a resignation of the health minister. The UUP health minister, Mike Nesbitt, needs to resign over this. This is utterly disgraceful. In my view, it should bring down the Assembly. They have brought down the Assembly in the past for spurious reasons. Frankly, it's better when they don't even meet as an Assembly. Direct rule is much preferable to this. So I would believe that the minister should resign, the bill should be pulled, but preferably the Assembly should fall over this. It is utterly disgraceful.
Thank you, Jeff. And building on what Jeff just said, Liz, and your point around the fact that the proposed legislation contravenes numerous human rights and legal principles, do you think it's going to be lawyers in court fighting this? Do you think it'll be people on the street? You know, how do we think we can actually get to some of the outcomes that Jeffrey's kind of outlined there?
Well, there was a really encouraging announcement on Twitter yesterday from the human rights lawyer I was talking about, Michael Brentnell. they've just announced that they have a client who's obtained legal aid funding for a judicial review of the actual public consultation, because it's actually may not even be legal, because it doesn't comply with the 2018 consultation principles. The first one being it has to be clear and concise and to avoid lengthy documents. So, I mean, I can attest to the fact that it is definitely not that. So therefore, that means a lot of the public just simply won't have the wherewithal to be able to engage meaningfully with it. It's meant to be informative, and that it's meant to contain an impact assessment. I was looking through these consultation principles. There is no impact assessment. And I wrote this in my consultation. It's like, you're not even telling us what the risks and the costs of this proposed bill are, you know, the wider cost to public health. And this is again the pattern we saw during COVID, didn't we? Nothing was ever costed, or the wider impact was never put forward. So therefore you ended up with this incredible micromanagement on a tiny point, and just ignoring the complete destruction that was caused by it to wider society and health and human rights. And I would just say, you know, surely after COVID, we should actually be rewriting public health law to restrict the authorities further.
Absolutely.
To put really clear limitations around their power, and to strengthen in law the individual rights and medical ethics. There need to be red lines put into public health, where you cannot go, whatever the measure, whatever the circumstances, you can't step over a line, because the whole point of ethics and laws is for in an emergency situation, actually, when people are panicking and they seek to override individual autonomy because they sort of think, oh, for the greater good. But actually those human rights, those medical ethics are to protect the individual from abuse and atrocities. And they are far more likely to get abused and atrocities to happen in an emergency than they are in normal circumstances. So that's when we have to really almost put extra focus on rights, individual rights in these situations. And I think that's the lesson of COVID. And that's what any sort of redrafting of laws needs to be thinking about, because none of this is coming from, you know, you can ask, where has this bill come from? Is this public outcry to say we need our governments to have more control? We want totalitarianism. We're desperate not to have to make any decisions for ourselves. This is not coming from the public. This is a top-down, very draconian, very totalitarian medical tyranny being sought. And we absolutely have to make sure this doesn't go through.
Thank you, Liz. And Jeff, you mentioned there's going to be a protest in Belfast this weekend. Do you think the public voice can make a difference here and perhaps drive the minister to resign in the way that you described?
Yeah, because, you know, Liz mentioned, you know, the grassroots movement. This is where it's come from. People are absolutely furious about this, and understandably so, as am I, you know, as is Liz, you know, because this offends the most basic standards of human decency. So yeah, 12 o'clock tomorrow at City Hall, Belfast, there is a major protest event organized. I imagine, you know, certainly the feedback so far has been that people will attend. I mentioned earlier the fact that we put a petition up on the 30 Degrees website, 38 Degrees website, which is a petitioning platform, supposedly to allow ordinary people to petition, to bring truth to power, you know, and petition against legislation of this nature. And the petition was put out last Sunday, and within 36 hours, we had over 6,000 signatures from right across the United Kingdom, because people were suitably and appropriately appalled at this. But 38 Degrees decided in their wisdom to pull that. And this is the statement that Dan's showing here as to why. And of course, what is the reason given? Well, the reasons are that, you know, they cite the statement from the Department of Health that this is a consultation. In other words, our action, our petition against the Northern Ireland Health Department's consultation it was taken down because they cited a response from the department that we were protesting against. Now clearly these sites, such as 38 Degrees, have their own political bias. And if you look at the directors and so on of this organization, they do clearly come from a lefty authoritarian background. And again, just to come to the point that Liz made about these types of things coming from on high, that's exactly how tyrannies happen. That is how totalitarianism happens. Bureaucrats implement totalitarianism. People who rubber stamp implement totalitarianism. People who don't think implement it. And that's how the tyranny of Nazi Germany happened. That's how the tyranny of Pol Pot happened. It is backroom bureaucrats implementing this and not thinking and not engaging their brains. So thankfully, there's a large number of people in Northern Ireland are appalled at this, and way beyond Northern Ireland. This has gone international. We've been getting tweets from all over the world, our content being shared everywhere, because people can see, because they saw what happened to the truckers in the protests in Canada. They saw what happened to people in Australia who protested against the de facto mandatory vaccination program in Australia. And they are right to be utterly spooked by this and to be taken to the streets. So I hold the organizers who have pulled this together in very short order. I hold them in the highest regard. It's wonderful what they've done, but the people who are organizing this are ordinary people who don't want to live in this type of society. Northern Ireland is and always has been, despite the Troubles, and certainly since the ending of the Troubles, been a peace-loving and freedom-loving place. And to have this implemented by a so-called unionist minister is utterly appalling. So they're going to come out to the streets tomorrow at Belfast City Hall at 12 o'clock at noon.
Yeah, and I'd also say our UK Medical Freedom Alliance, we've set up a campaign page. So if you're not in Belfast or not in Northern Ireland, you can't get to the protest. We've got lots of calls to action. So it's ukmedfreedom.org. If you go to campaigns, it's the first one, which is Stop the Northern Ireland Health Bill, something like that. And we're encouraging all Northern Ireland residents to write to your MLA. And there's various template letters, including from the Northern Ireland campaign. We've got links to those. But also there's an email address for the actual health minister, which anyone in the world can write to. So just even if you just write a paragraph expressing your opposition, we've published our own submissions, so you can take little bits from that or from articles I've written or from the template letters that the other groups together have also put together a really good template letter. So basically we've got till Monday, and I think anything that goes in, whether by email, whether you do the consultation, I wouldn't recommend it at this point. Or whether you write to your MLA, that will all count. And I think it's interesting. They are rattled. They've already extended the consultation. They then put out a statement, the health department last week, saying, oh, yes, we've had lots of engagement with this, but we're a little bit worried that some people are misunderstanding it. So they've tried to clarify things. And then obviously they're now facing a legal challenge as to the actual legality of the consultation. So I think, we do have the power, and I think we just have to step into that power and, in a democracy, make our voices heard and believe that actually I think they will back off. So I'm hopeful.
Thank you. And Jeff, on that point that Liz has made in terms of the kind of watering down of the statements on the website, I quote from the Northern Ireland government website around the point around mandatory vaccination, which is being picked up by the BBC today. This, to quote, has been included in the public consultation to give people the opportunity to have their say. I mean, that sounds like very clever newspeak to me, to present fundamental freedoms as an opportunity. I mean, how would you respond to that?
Well, these consultations rarely involve the public. They tend to be written, as I mentioned right at the top of this, they tend to be written for organizations and NGOs and quangos and so on, and local authorities to respond. they tend to have the kind of backroom people who will respond in the most appropriate way. And as Liz mentioned earlier, wading through a consultation document like this is not easy. But I repeat the point that I made earlier. The consultation itself is asking for us to consult on proposals that are repugnant and that no democratic society should be under any circumstances considering. So Michael Brentnell, in my view, is absolutely correct. This contravenes UK statute. It contravenes some of the most fundamental human rights. And therefore, the consultation de facto is illegal. It is unlawful. And so I do encourage people to respond. I think Liz is right that people should be writing to the email address, to the department and to their MLAs protesting about this. But it only requires a couple of sentences. We do not need this law, and it is draconian, and it shouldn't be implemented by any democratic institution in the United Kingdom. So I would be keen that people are appalled rather than spend a huge amount of time filling out a consultation template document. Thankfully, Liz has done that on behalf of her lobby group, and the Campaign for Medical Freedom. But the consultation itself is not the issue. The process is not the issue. The minister isn't even the issue. It's the fact that they're implementing legislation that is unlawful, and people should make everybody aware of that. But the other point I'd make too is this has already been implemented in Scotland. They very successfully did get it through the back door in Scotland. Nobody seemed to notice. And of course, the fact that the Scots Nats have kind of gone away. The Scots Nats were very, very keen on this authoritarianism during the COVID era, but now, of course, they've got the number of representatives representing the Conservative and Labour Party and so on, the Uni Party, as I like to call them, is much greater in number, and therefore they're going to rubber stamp this type of legislation because they wouldn't see it as abnormal. So it was slipped through the back door in Scotland. Northern Ireland, by its nature, is akin to a UK county council. So we have our own justice department, for example, and we also manage our own policing. So the Northern Ireland Assembly, to all intents and purposes, Northern Ireland's a tiny place. It's only a population of 2 million, the size of Greater Manchester. So it's a tiny place, and but they have to go through the procedures to get this type of law implemented. But the likelihood is that they've already done it in Scotland. The likelihood is they're probably going to try to do it through local authorities in GB, in England and Wales. So it's a test case for Northern Ireland. It's an administrative test case. They're going to get it through, but be in no doubt the World Health Organization treaties and the amendments to the International Health Regulations will ultimately make it into UK law or bylaw, and these types of things are going to be implemented unless we kick up a hell of a stink about it. And that applies to everybody across the United Kingdom. It's a wee bit of a red herring that this is a Northern Ireland focused campaign. We just happened to find out about this in good time, but the people of England and Wales and Scotland should be equally concerned because this is, as I've said many, many times before, the beginnings of a totalitarian police state if they get this through.
Yeah, and I just saw someone in the chat mentioning Canada. They have a very similar bill. This is going out everywhere. And just for people in Scotland, have a look at, we didn't even spot this. This went through in 2022, the Coronavirus Recovery and Reform Scotland Act. And in there, I can't remember, it's section 86G called Special Restrictions and Requirements is a cut and paste pretty much, apart from the odd word change, to the list of the horrendous regulations, special restrictions or requirements that are in this bill consultation on page 47 around requiring a person to submit to medical examination, to be removed to hospital, to be detained in hospital, isolation, vaccination. So all of that list is the same as this Scottish Coronavirus Recovery and Reform Act 2022. So I don't know how they sneak that through. I would suggest maybe people in Scotland need to start like lobbying against that, because you've actually got that in law now, which is a real worry.
Yeah, I mean, just to conclude, people are asking, is this symbolic of the authorities overplaying their hand? But the very fact is that you're mentioning, and other people are talking about similar bills in other parts of the world, yet they're going through with some or minimal resistance. This one is obviously lit a fire, and now people are pushing back. But I suppose my wider concern is that the COVID chapter has almost created a divide in society. Those who will kind of quietly comply with things like this and show no resistance and silently go into dystopia. It's always the most anti-freedom ideas that are couched in the illusion of choice, give people the right to choose their dystopian future under the name of safety.
Yeah, it's constantly reframing the Overton window, isn't it? It's just saying...
And it's the normalization of the unethical. People have been just kind of conditioned now to accept stuff that if you'd asked them 10 years ago, they would have said was outrageous. And I think that's a really dangerous slope, because, it's been said many times, once the government takes power, they don't give it back voluntarily. And you see, we're just literally hurtling down this slippery slope of state overreach, and they want more power, they want more control. There's this micromanagement desire. They believe I think some people genuinely believe if we could just manage it right, we could eliminate risk. And of course, that's just, nonsense.
Well, it's the path to the ultimate dystopia. It's, this is the ultimate centralization of society, which is, what we've really been standing up against. And, you've both referenced that this is, stem from the pandemic treaty and the amendments to the international health regulations. And you're absolutely right. Throughout that period of campaigning that we conducted during the course of the adoption of the international health regulation amendments, the WHO would constantly rebut that, the national governments will retain their sovereignty. But lo and behold, that may be true in hard terms, but in soft power terms, the influence that these organizations have through their networks and their conglomerate associations means that the very supposedly sovereign governments take that legislation and try and propose it through their own systems, which is exactly what we're seeing, exactly as you outlined, which is why it's really important that we not only resist this particular bill, but of course the pandemic treaty right now is on a tight timeline now. If you're not aware that the finalization date is due for November for the World Health Organization. The amendments have already been passed and largely adopted. And now we've got less than a month really to resist the pandemic treaty. And of course, if that is passed, then we can expect to see more and more of these kind of, whack-a-mole situations with governments popping up these bills left, right, and center to fulfill the obligations of these global tools. So I want to thank you both for your commentary on today's issues and for your work to raise awareness, but also to take action. So I want to recap some of the things that you can take a look at as a result of today's discussion. Firstly, there is a protest taking place in Belfast this weekend at Belfast City Hall from 12 p.m. onwards. You can see that there. You can also see details of the Stop the Northern Ireland Health Bill campaign at stopthenihealthbill.org. We'll put the links in the chat and the description for you. We also discussed Liz's campaign at the UK Medical Freedom Alliance. You can see that over here at on the website here that we've got here for you. Again, the links will be in the chat, ukmedfreedom.org. Under campaigns, you can see the Stop the Northern Ireland Public Health Bill. That's where you'll also find the public health consultation submission, the email addresses, template letters, etc., that you can use. And Jeff also mentioned the 38 Degrees petition. It's fascinating to read the responses that have been issued by 38 Degrees. So go ahead and take a look at that. We'll put all of the links in the chat for you. And thanks again to both Jeff and Liz as being our wonderful guests today to help raise awareness. Any parting words, Jeff?
Just to thank you, Dan. You and Liz have been stalwarts throughout this process. And we don't, as we had a conversation just before this went out. That it's just very comforting to know that there are people out there who, even though we haven't spoken to each other in years, we can pull together when we are faced with these crises imposed from on high. So I'd just like to thank you for your sterling efforts as well. They're, obviously, even though we may not be in direct communication all the time, they don't go unnoticed, and it's wonderful that we have so many incredibly erudite speakers and freedom fighters in the United Kingdom. This is I still believe, the greatest democracy in the world, but we can't let it be hijacked by thugs and authoritarians wanting to pull it away from us. So thanks again.
Thank you, Jeff. Any closing words from yourself, Liz?
Yeah, thanks. So I would echo everything that Jeff just said, and just to say I am hopeful, because I think it's really obvious. I think they're almost overplaying their hand here. It's so outrageous, and actually people really have reacted strongly. So I think we have to kind of keep the faith and just keep putting one foot in front of another. Don't feel overwhelmed, but if everyone does their bit, this cannot happen. So yeah, that would be my word. Keep the faith.
Thank you very much, Liz. Thank you, Jeff. Do check out the links in the comments below. Do take action, and together we can push back against this bill, and we will continue to fight for our freedoms. Thanks again. My name is Astin-Gregory. This has been, well, we'll call it an episode of the Pandemic Podcast. It does seem, as I said at the top of the session, that unfortunately the aroma of medical authoritarianism, public health authoritarianism, and tyranny is still well and truly upon us, and we must continue to fight until we can create a